Tuberculosis, or TB, is one of the world's deadliest diseases. Every year, nearly 9 million people around the world become sick with TB disease. While the number of people in the United States with TB disease has been slowly decreasing since 1993, it's still a problem among certain groups. Tuberculosis is a disease that can affect any part of the body, but the infection most often targets the lungs. So we'll look at some chest x-rays later on in this presentation. But most TB cases are caused by inhaling the bacterium. People can get TB when an infected person coughs, sneezes, speaks, sings, or laughs. So here are our learning objectives for this presentation. First, we need to explain how TB is spread, list the signs and symptoms, explain who is at risk, tell how it is treated, cite the BCHS policies that pertain to the clinical rotation, and then identify protection measures. Brief overview. We'll get some facts from the Centers for Disease Control and Prevention. We'll look at the BCHS policies, and then we'll talk about how protection measures work. So how is it spread? TB is a disease caused by bacteria that are spread from person to person through the air. TB bacteria are put into the air when a person with the disease coughs, sneezes, speaks, or sings. People nearby may breathe in the bacteria and become infected. TB bacteria usually attack the lungs, but it can attack any part of the body, including the kidney, spine, and brain. Why is it hard to diagnose? There are two forms of TB. The first form is latent TB infection. People with latent infection don't feel sick, don't have symptoms, and can't spread TB bacteria to others. People with latent TB infection can go on to develop TB disease. This is the second form. People with TB disease feel sick, have signs and symptoms, and may spread TB bacteria to others. What are the symptoms? Symptoms of TB disease include a bad cough that lasts 3 weeks or longer, pain in the chest, coughing up phlegm, which is really pleasant, sometimes with blood, even more pleasant. Other symptoms include weakness or fatigue, weight loss, no appetite, chills, fever, night sweats. Who's at risk? While anyone can be infected with TB bacteria, some people are more likely to get sick than the others. So the way I remember it is migrant alcoholics with HIV. Those with a higher chance of getting TB include people with HIV infection, those who have been infected with TB over the last 2 years, people with other health problems that make it hard for the body to fight disease, people who abuse alcohol or illegal drugs, those who are not treated for TB infection or TB disease in the past. How is it treated? 2 kinds of tests are used to detect TB bacteria in the body, the TB skin test and TB blood tests. These tests can be given by a healthcare provider or local health department. Not everyone needs a TB test. Only certain people who are at increased risk should be tested for TB. That's us. If you think you've been exposed to someone with TB disease, contact us, right? Contact me or Deborah here at the school, and we will work out the ways to get you tested. We'll talk about that here in a minute. So the good news is that both latent TB infection and TB disease are treatable. The treatment for latent TB infection can keep you from developing TB disease, and TB disease can be treated and cured using several antibiotic drugs, usually for 9 to 6 months. You have to make sure you take all the drugs, right, with TB. If you do not complete the drug cycle, then we might wind up making some super drug-resistant form of TB. So I've included this slide. This comes directly from the BCHS Catalog in the Division of Allied Health, page 53. One of the ways that we work with policies and procedures related to TB has to do with documentation of current TB skin tests, both at the time of enrollment in the college and then annually thereafter. So before you even entered this program, you should have already received the first line of defense against TB. Within our medical radiography program, we look at the student radiography handbook. You'll notice I've highlighted here, you will not be fitted for an N95 high filtration respirator. So you won't be wearing one of those duckbill masks. That means you should never enter rooms or participate in exams which require the use of an N95 high filtration respirator. In those cases, we are doing x-rays of a patient who has active TB, therefore they are contagious, right? They are contagious. And to prevent its spread, we have asked students not to participate in those exams. Now, one critical thing here is going back to the fact that there are two forms of TB. A person with latent TB cannot spread the disease. The body's immune response to TB is to form a calcified cavity around TB and prevents its spread until that cavity breaks, until the bacteria breaks through that cavity, at which point the person becomes actively infectious and they can spread the disease. If for some reason, while you're in the clinical environment, you believe you've been around a person who has active TB, you need to complete the agencies, so whatever clinical site you're at, you need to complete their unusual occurrence form, or maybe it's called an incident form. Speak to the supervisor at that place and document it. That needs to happen on that day, right? Then you need to notify University Health Services at the phone number 901-448-5630, and you need to tell them about this occurrence, that you believe you've been around a patient with active TB. And the University Health Services will provide counseling and follow-up. Go ahead and notify me or Deborah or the program chair, and we will notify the academic dean, right? If you need her, if you want to email her as well, her name is Carol Warren. Carol Warren is the academic dean of Allied Health. Notify us, and we will continue to work with you and with the clinical site to clear up any questions about it. So, what are the protection measures? Well, I just detailed the administrative controls, the policies and procedures that we have in place to protect our students from tuberculosis exposure. Just know that in the clinical environment, there's also environmental controls. So before you ever enter a patient's room who has active TB, you would know because the room is sealed and it has a special ventilation system. In addition to that, people will be required to wear masks and gloves and gowns before they enter that patient's room. So, personal respiratory protection for individuals going into a room with a patient who has active tuberculosis include the N95 mask, which again, you will not be fitted for one of these masks because we do not want the situation to arise where you are ever entering a room during your student experience with a patient who has active TB. Nevertheless, once you have completed all of your requirements here at Baptist and are a registered medical radiographer, you will probably need to be fitted for an N95 mask depending on the institute, the location that you're at. I should add that most hospitals and healthcare facilities are required by law to provide you with an N95 mask fit test before entering employment there. So one critical question here is, you'll notice within these protection measures there's not vaccination protocol. There is a vaccine available for TB. It's not recommended in the United States because the rate of TB infection is low and because vaccinating people would make the TB skin test less useful. So someone vaccinated against TB may show a positive skin test even if they're not infected, especially in the few years following the vaccination. So infants who live in areas of the world where TB is preventable should be vaccinated against TB. The vaccine does not work very well in adults. Nevertheless, within the United States, at this point, no one needs to be vaccinated from TB. So one additional protection measure that we have the advantage of here in the medical radiography department is that we can look at the images that we generate as we're doing pictures of our patients, and if we suspect that they have TB, while we're not making any kind of diagnosis or anything like that, we're not doctors, it is within the scope of practice to review the images and to evaluate the images and to establish whether or not we have a good chest x-ray. So the disease that's caused by Mycobacterium tuberculosis is spread by the inhalation of infectious material, so we would expect to see it first and foremost in the lungs, I should say. It's spread also along lymphatics, so sometimes hilar enlargement or enlargement around the heart is another important sign on a radiograph. Other signs include bacterial bilateral infiltrates of the lungs, which are mottled, and calcifications that are streaked in appearance. So this is a PA chest x-ray of a patient who has had tuberculosis for years. This shows fibrosis, cavitation, and calcification, particularly in the left upper lobe. So I will circle this cavitation. You'll notice it's kind of circular shaped right here, that little white circle within my circle. So here is a more obvious case. As the disease progresses, that cavitation will erupt and the bacteria will spread throughout the lung and form fibrous tissue or scars as the lesions invade the lung, leaving scars with calcification, and that cavities commonly develop. So this is very clearly indicated on this image. Here are some of my references for this presentation. Thank you so much.